Overdose deaths are the leading cause of accidental deaths in Utah, even more than car accidents. In Utah, 6 people die each week from opioid abuse. In southern Utah, overdose rates are 1/3 higher than the national average.
Intermountain is making this investment because we've seen firsthand in our hospitals and in our homes the terrible toil that this has on families and people's lives.
Dixie Regional Medical Center is making the message bold and clear to all who enter their hospital on elevators, walls, and even floors that opioids are highly addictive, dangerous, and there are options.
What we're hoping to do is reduce the deaths and heartaches that come from prescription opioid overdose.
Recent studies conducted by Intermountain Healthcare in Utah found that only about half of the pills prescribed to patients are even taken.
About 19 million opioid pills are prescribed each year through Intermountain clinicians. You do the math, half of them not taken, that's almost 10 million tablets per year in Utah just for Intermountain. That is a pretty frightening number.
In the last 2 years, 33 deaths were reported by a local newspaper as a result of misuse of opioids.
In 2014 and 2015, 33 people in St. George died from opioid overdose. These numbers are alarming, but as you think about it, behind each one of those numbers is a person.
In order to keep these leftover pain medications out of the hands of potential abusers, Stapley Pharmacy has agreed to place a drop box in its downtown location.
If you provide a neutral, safe space for people to come and drop off those unused drugs to help eliminate the farming, PHARMING, the farming from grandchildren, children, neighbors, if we can provide that safe space, they're much more likely to come and get rid of the drug.
Educators in the field of prevention are hoping that more people will get the word, and so far it's working among our youth.
From 2015 to 2017, we also saw an increase, but rather than doubling, the increase was 0.1%. So we've gone from this being the fastest rising drug of abuse among youth in our community to just an infinitesimal increase. We've really slowed it down, and I believe that that's a result of efforts like this.
Utah drug overdoses have dropped over 10% since February. They believe it's because of the awareness of this significant problem. But the truth is, not all pain can be treated with medication. Local addicts say it's just a matter of time before it catches up.
It destroyed my life. It destroyed everything that I loved and everything that I cared about. It destroyed the relationship with my mother. It destroyed the relationship with my family. And it destroyed every single thing that I ever had or ever wanted.
Intermountain has already set a goal to drop its prescribing of opioids by 40% over the next year. It's going to take education and lack of availability to keep leftovers out of the wrong hands and used improperly. While prescription painkillers come in all shapes, colors, and sizes, people need to understand that if they aren't taken as prescribed, they truly do become deadly killers of pain. In St. George, Melissa Anderson, CEC News.